Nutrition is fundamental to health and impacts healthcare beyond hospital walls.
Registered dietitians significantly impact and empower patient care. Hospitals who are being proactive and including strategies to get input from dietitians may improve patient outcomes and reduce readmissions and adverse effects.
So a dietitian is an integral part of a team that works with patients, and they can help tailor someone's nutrition to help prevent a disease or help take care of a disease after it's diagnosed. Everybody eats every day, and very important.
I usually have music going on right now, which really helps the food. Don't laugh. The music goes into the food. There's nothing about being healthy in my former life. But I bumped into heart disease and had to do a lifestyle modification with diet and exercise. What I discovered, even though I was a graduate of the Culinary Institute of America with decades of experience as a professional chef, I had a problem when I went back to learn how to cook without salt, fat, and sugar. I had to go back and learn how to cook all over again. I learned to make some food that I could eat for the rest of my life. So I decided to go back to school to become a registered dietitian.
Most hospitals offer financial support through programs like Grow Our Own, which helps staff earn educational certificates while working.
But you need to be aware of where your patient is and provide them what they need. And a lot of times it's not a matter of limiting what a patient is eating. It's making sure that they eat. I need to do that more often than not.
But if we think about holistic care and look to fully improve a patient's outcome, we have to include every aspect of the patient's life at home. That's where a registered dietitian can empower patient care and outcomes. Dietitians can systematically identify patients who are malnourished or at risk and can promptly intervene to prevent further life-threatening complications. And there is evidence that shows early nutrition intervention can improve patient outcomes.
Smith County Memorial Hospital gives access to healthy food choices to our community by having an open cafeteria in our hospital and a Meals on Wheels program.
I use Meals on Wheels to get food in the front door of people's homes. It's important because that is a very important community outreach tool that the hospital uses to affect positive health in the community. We have a ton of people here, and I see it every day. A lot of the people that we sign up for Meals on Wheels are people that are doing extended rehabilitation for whatever reasons they were here. They're going to go home and rehabilitate a couple of weeks more. So we offer Meals on Wheels to those people to do for 1 week, 2 weeks, 3 weeks, a month, whatever it takes. Because it's hard to get back up on your feet and be able to cook for yourself. We feed the people, so that's what we're trying to do.
I feel the same way that many other people do who work in healthcare, and that is I do it because it's what I get fulfillment out of, taking care of other people.
If you really care about people and you really want to make a difference in rural Kansas, this is a good place to be.
It's something called the spirit of hospitality. But I take that into the room. And that's something I learned in decades in high-end hotels and restaurants. And that is just a love of wanting to please people and provide the highest level of service. We have an effect on the community, and it's a great way to give back and earn a living while you're doing it. Something you can be proud of.
People think about healthcare being doctors and nurses, and it is that. But it's also laboratory technicians and imaging technicians and accountants and dietitians and cooks and environmental services staff and maintenance staff. We need all of those people to make this organization run. So if there's somebody who is graduating from high school and is looking for a career opportunity in a location in or near their small rural community, the chances are there absolutely are opportunities there for them. And I would say talk to the people in your local hospital, because they can help you understand, they can help you plan for your future and make it collaborative with what their needs are.